Last time we discussed about effects of glucocorticoids on vascular phase of inflammation, and now we'll discuss their effects on cellular or mobilization phase. And we'll also discuss effects of glucocorticoids on resolution phase. In cellular phase of inflammation, inflammatory cells like neutrophils first attach to endothelium of blood vessels and then pass through endothelial lining and reach to site of inflammation. First we'll discuss normal process and steps of this phase and then see how glucocorticoids affect different aspects of this phase. We'll discuss this process for neutrophils, as neutrophils are first cells to arrive at site of inflammation. However, similar process is required for infiltration of other cells like monocytes. Three factors contribute to this process. First is adhesion molecules. Neutrophils attach to endothelial cells with these adhesion molecules. These adhesion molecules are present both on neutrophils and endothelial cells. Second factor is cytokines like IL-1 and TNF-alpha. These cytokines are produced at site of inflammation, and these cytokines increase expression of these adhesion molecules. Third factor is chemokines. Chemokines affect some of these adhesion molecules, and chemokines also guide neutrophils to site of inflammation. Now suppose there is source of inflammation here like presence of bacteria. So cells that detect these signals secrete cytokines like IL-1 and TNF-alpha. These cytokines then increase expression of adhesion molecules on endothelial surface. Neutrophils then attach to these adhesion molecules, and neutrophils then pass through this endothelial lining and reach to interstitium. From interstitium, neutrophils move towards source of inflammation by process of chemotaxis, and this movement is guided by chemoattractant molecules. Now let's discuss this process in more detail. Increased vascular permeability during vascular phase results in relative stasis in blood vessels, and this brings neutrophils close to endothelial cell surface, and this process is called margination. In this position, neutrophils can interact with adhesion molecules present on endothelial cell surface. First binding of neutrophils to endothelial cells is through adhesion molecules called selectins. Selectins are present both on neutrophils and endothelial cells, and selectin bind to selectin ligands. Selectins provide temporary binding of neutrophils to endothelial cells. Neutrophils can move with blood flow, and they detach from one point and attach to other point, and this process is called rolling. Neutrophils at some point then come across chemokines. Chemokines are present on endothelial surface. Neutrophils also have other type of adhesion molecules on their surface called integrins. Integrins are normally present as low affinity form. Interaction of chemokines with neutrophils change integrins from low affinity form to high affinity form. This high affinity form of integrin then bind to integrin ligands present on endothelial cell surface, and this provides strong binding of neutrophils to endothelial surface. Neutrophils then pass between adjacent endothelial cells and leave blood vessels, and this process is called transmigration. Neutrophils then move in tissues along chemoattractant gradient and reach site of inflammation. Chemoattractant molecules include bacterial products, cytokines, chemokines, and products of complement system. Now let's discuss effects of glucocorticoids on different aspects of cellular phase. First, glucocorticoids decrease production of cytokines like IL-1 and TNF, as these cytokines increase expression of adhesion molecules on endothelial cells. So decreased levels of these cytokines will decrease expression of these adhesion molecules. Glucocorticoids also affect adhesion molecules. Glucocorticoids decrease synthesis of selectins both in neutrophils and endothelial cells. Low levels of selectins then prevent binding of neutrophils to endothelial cells, and this contributes to increased number of neutrophils in blood. Glucocorticoids also decrease synthesis of integrins in neutrophils and integrin ligands in endothelial cells, like intercellular adhesion molecule 1 and VCAM1. Glucocorticoids also affect function of integrins. Glucocorticoids increase production of annexin 1, and annexin 1 prevents change of low affinity integrin to high affinity integrin. And annexin 1 can bind to integrin ligands on endothelial cells, and this prevents binding of integrin to integrin ligands. And finally, glucocorticoids decrease production of chemokines and chemoattractant molecules. Decreased production of chemoattractant molecules prevent migration of leukocytes to site of inflammation. So low levels of chemokines, chemoattractant molecules, and adhesion molecules decrease number of inflammatory cells at site of inflammation. Now let's see effects of glucocorticoids on resolution phase of inflammation. Glucocorticoids suppress both vascular phase and cellular phase. However, glucocorticoids promote resolution phase of inflammation, that is anti-inflammatory phase. Glucocorticoids increase expression of anti-inflammatory cytokines like IL-10 and transforming growth factor beta, and these anti-inflammatory cytokines prevent release of pro-inflammatory cytokines. And glucocorticoids also promote anti-inflammatory phenotype of macrophages, and these macrophages produce anti-inflammatory cytokines and promote resolution of inflammation. So glucocorticoids suppress vascular and cellular phase of inflammation. Benefits of use of glucocorticoids in inflammatory conditions is that they decrease redness and swelling associated with inflammation and prevent tissue damage due to infiltration of cells in inflammatory and autoimmune conditions. However, anti-inflammatory effects of glucocorticoids can increase risk of infections and affect wound healing due to their effects on inflammation. In this section, we discussed about effects of glucocorticoids on cellular and resolution phase of inflammation. In next section, we'll discuss effects of glucocorticoids on inflammatory cells like neutrophils and macrophages.